According to the 2014 Kenya Demographic and Health Survey, 1 in 5 Kenyan teenage girls is a mother. So you can imagine 1 in 5 Kenyan teenage girls are already mothers. Similarly, 379,573 teenage girls were made pregnant by the end of 2019, as reported by the National Council on Population and Development. And I was saying that the report that was released early this year indicated that Nairobi, Kakamega, Kajiado were leading in terms of So we as a teacher, we have a mandate to play, we have a role to play, so that we give this information, the right information to our girls. What are the causes of teenage pregnancies? Teachers, we can share through the chat box. What are the causes of these teenage pregnancies? Let's share our responses in poverty, peer pressure, poverty. Thank you for responding. Rape, early maturity, poverty, poor parenting. Yeah, those are some of the causes of teenage pregnancies amongst our youth. Rape, GBV, innocent, curiosity, love of money, and many, many others. Let's go straight to add on what you have just indicated. And we are saying that lack of information about sexual and reproductive health. Most of these youths do not have enough info on their reproduction, their sexual and reproductive health. Wengine wanataka kujaribu. Wengine it's because pressure, peer pressure to engage in sexual activities and to marry. Lack of inadequate sexual reproductive health services tailored to you. And when we talk about youth-friendly services, poverty also pushed teenage girls from poor families into sexual activities in exchange for food and other forms of necessity. Sexual violence, drug and substance abuse, harmful culture practices like child marriages. These are some of the causes of early teenage pregnancies in our country. And you understand that this during lockdown, most of our youths were engaging in unprotected sex, and there was a high rate of teenage pregnancies in our country. So what kind of support would you give to pregnant girls and the teenage fathers? Yes, let's see our responses through the chat. Yes, what kind of support would you give to pregnant girls and the teen mothers? Psychosocial support, very good. Emotional support, counseling, reassurance. Yeah, let them reassure about their lives, about there is always go back to school policy. Let them assure them guidance and counseling, good, conducting counseling and services, moral support. Thank you very much, participants, for your responses. They are coming in very fast, ensuring that they are supported. Rehabilitation, offer guidance and counseling, emotional support, guiding and counseling. Thank you. So we shall continue to add on what you have just said. And we are saying that how to support pregnant girls and teen mothers, raise awareness on their sexual reproductive health. It's good to raise awareness on their sexual reproductive health. These are called friendly services and are designed to address the barriers faced by youth in accessing high quality sexual and reproductive health services. And some of these services include counseling and testing, knowing the HIV status, and many others. Then encourage them to use adolescent-friendly services in health facilities, provide linkages for counseling and psychosocial support, allow school reentry in order for them to complete their education. And you remember a new policy was introduced in Kenya in the year 1994 that enables teenage mothers to go back to school after giving birth. protect them from abuse and violation, support with baby care services when they go back to school, support with postnatal services for their babies, also link adolescent mothers with livelihood programs. Very, very important. So what is the Minister of Education and the other stakeholders doing to ensure that these learners are back to school? One, we have sensitization of learners, parents, guardians, and the school community on children's rights and protection. Let the children know their right, but that it is their right to go back to school even after giving birth. Yeah, it is their right to get their basic needs. All learners who would have dropped out of school for whatever reason can re-enter school at the same grade. So it's important to note that all learners who would have dropped out of school, maybe due to pregnancy or certain behavior, then they are allowed to go back to school at the same grade. Unconditional readmission unless stated otherwise. Yeah, you can either readmit this child to the class that she was in before she got pregnant, or you can readmit into another class. Teachers to help learners recover missed lessons. It's very important, teachers. You know, you are playing a very important role by giving knowledge and to these learners. Therefore, it's good that all learners who have missed lessons while they were still at home due to pregnancy cases, they should be helped to recover all the lessons others learned while they were not in class. Re-entry period will be at the beginning of every school calendar. Yeah. So, for example, if this girl missed school, for example, she left school January, then she should go back in the other year, after January the other year. So teachers to sensitize other learners and the school community not to discriminate pregnant girls or teen mothers. It's very important. Let's not discriminate. Let's not discriminate these learners who got pregnant while they are still in school. Let's encourage them. Let's give them support as good as possible. Teachers to sensitize other learners and the school community not discriminate them against these girls or these teen mothers. So thank you very much, teachers. Hello, are you able to hear me? Huh? Yes. Oh, okay. Oh, sorry. Okay, thank you. So we have talked about how to support pregnant. Well, I just want to add on examples of youth-friendly services. When you talk of youth-friendly services, we are talking of HIV testing and counseling treatment. Let them know the HIV status even if they are pregnant. STI and the counseling, prescribing appropriate medications and health products. Yes, if they are pregnant testing. Am I back? Hello, yes? Can you hear me now? Not muted. Yes, you can. Yeah, I'm using this one. These are the ways to support pregnant girls and teen mothers. Okay, so let's continue. I was talking of, I was giving examples of youth-friendly services, and we talked of HIV testing and counseling. Let them know the HIV status. Then STI and counseling. prescribing appropriate medication and health products, and then counseling services, sexual abuse counseling, relationship counseling, and others. So that is how to support. That is how to support pregnant girls and the teen mothers. For more information, yes. For more information, you can log into www.education.go.ke, where you can get more information on teenage pregnancies. Thank you very much. You can type on chat box. We'll address them after this session. This has left. She has not come.
The challenge with sound. Thank you, participants. Let's keep interaction with Mr. Jackson Kihima on the issues of teenage pregnancy as we prepare for the next presentation. Thank you, participants. We have noted your concerns and questions. We'll be able to respond to some of them concerning the issues of how you look at the presentation, even before we conclude the day. So we'll do that. So thank you, Jackson, for that presentation.
Good afternoon. We are preparing for the next presentation. Thank you, Jackson, for the good presentation that you have given. Keep your concerns coming through the chat box, and we'll respond to them later. We are beginning the second presentation this afternoon shortly. For those your hands, kindly get your concerns through the chat box so that we're able to respond to you.
You are ready? Our second presentation this afternoon is on alternative ways of curriculum delivery and the facilitated.
Good morning, everyone. Good afternoon, everyone. We are going to go through the alternative modes of curriculum delivery. And as all know, the COVID pandemic has caused unforeseen disruption not only to economies, but also to education systems. And as a result, the pandemic is changing the face of education in that education systems across the world are working to accommodate socially distanced by virtual schooling. It is evident that we cannot return to the world as it was before. And therefore, as facilitators, we now need to think beyond COVID-19 and embrace modes of curriculum delivery that will ensure learning continues even in times of crisis, such as this one. That is where physical schooling is not possible. We find that there are people or group of people who may not be able to learn in a classroom setup because of their health status and also because of their age. And in this context, we call them the vulnerable groups. We call them the vulnerable groups. And actually, from what you have learned so far, I believe you are able to identify any vulnerable learner and staff in your school. And we, of course, can think of how to protect them. So in the chat box, kindly give us examples of a vulnerable group or the vulnerable groups that we have. And also how we can protect them. Examples of the vulnerable groups we have and how we can protect them. Kindly share in the chat box. Okay, pregnant, the poor, young children, epileptic, getting albinism, 55 years and over, asthmatic children, sickle cell, orphans, the poor, those ones with chronic illness, orphan, HIV, those ones with HIV. Oh, thank you. The answers are varied. Thank you for presentation, for that presentation. Thank you for the answers. We can look at the vulnerable groups as adults who are 58 years and above, and also people with underlying conditions such as chronic respiratory illness, including moderate to severe asthma, obesity, those with underlying conditions such as diabetes, those with HIV, those with cancer, among the ones you have indicated in the chat box. And how can we protect them? How can we protect them? Just indicate in the chat box how we are able to protect the vulnerable groups. And age and with those, okay, they wear mask, allow them to work from home, allow them ensuring work from home, ensuring their safety, emotional support, online learning, providing adequate diet, giving moral support, working from home, assist financially, virtual learning, online learning, taking COVID jab, allow them, provide masks, giving materials. 58 years and above can work from home. Okay, those are very good answers. They are very good answers. Okay, we can actually protect them by always wearing mask and encouraging also to wear masks. That is everyone in the school. And this is to minimize the spread of the virus, which could occur through coughing, sneezing, and talking, or shouting. They can also be protected through or protect themselves through regular washing of hands, thoroughly with soap and clean water, maintaining physical distance at all times. We see whereby we said about 1 meter, then allowing learners, teachers, and other staff with conditions such as asthma to remain at home until they are well enough to resume school, meaning that they have to be checked as they enter the classes or as they enter the school compound. And if they are found to have symptoms of COVID, they can be told to remain at home. And we'll find that many times they are not able to keep social distance in schools. And in your chat box, kindly give us the reasons why we may not be able to, or we fail to keep social distance in our schools. Why do we fail to keep social distance in our schools? In the chat, it is because of high population, large employment, poor infrastructure, limited facilities, large population of students, small classes, limited, inadequate desks, lack of enough rooms. All those are varied answers. They are true. It is true. So among what on top of what you have indicated, we can add, or we can say that there are high learner enrollment and also limited space, as you have said. That is in infrastructure in most of the public schools. I don't know whether it is happening in the private schools, but mostly in public schools that is there. Children nature of high interactivity and playfulness, whereby they will never stick at one place. Inadequate supervision due to high pupil-teacher ratio in public institutions. those are the reasons why we may not be able, it is not possible to keep social distance in schools. Then how can we social distance ourselves in schools? How can it be enhanced? As teachers, we are innovative, and I believe we can find ways of distancing ourselves or keeping distance in our schools, which are, how can we keep social distance in our schools? So learning under trees is one of the factors given. Learning under trees, restructuring charting timetables so that some other will work in the morning or will come to school in the morning, others in the afternoon. Use of tents, that is good. Taking activities in shift. Learning in shift was possible. Online learning in shift. Okay. Construction of more classrooms. Use of open spaces. So thank you for your answers. Thank you for your answers. We move on. Actually, we can enhance social distances in school or social distancing in schools by rearranging students' desks and common sitting spaces to maintain the required space between learners. We can also avoid face-to-face sitting arrangement. As we reorganize the class, we ensure that the students or the learners are not facing each other. And also, as you said, moving class outdoors to create ample space and restricting movement of students while in the classrooms, suspending activities that have high rate of mixing. And here we are not saying doing away with the activities, but we are saying suspending activities and such as music, field trips. But I believe if the learners are told to run or to take a walk, they'll not interact, they'll not intermingle. Learners to take meals in shift and use open space instead of crowding in the dining hall, and also to provide adequate washing points, and not only washing points, but also soap and water in those washing points in different accessible locations to avoid crowding by learners. You can also, as you said, adjust break times to have different classes out at different times. We can restrict the number of visitors visiting the school, and also minimize large gatherings such as school assemblies, having shorter school day or school week. That one is actually by shift. And if that has to be done, you should actually work together or work with the Ministry of Education and TSC at the grassroots, so that they have it in their knowledge that you are doing that. Then students coming to school on alternative days, running 2 streams of class per day, have the class coming during morning, whereas the rest come during the afternoon. Then splitting double lessons into single to reduce the length of time the teacher spends in one class, ensuring students and staff who are sick learn from home until they are well. And now we say that we can use different ways or different methods or different modes of curriculum delivery. So in your chat box, kindly indicate the different ways of curriculum delivery would use in case the school is in recess, or in case the teacher is not feeling well, is over 58 and has to teach. Kindly indicate the various methods you'd use to ensure that learning and teaching goes on in the schools. Virtual learning, online learning, virtual learning, online, virtual sharing lessons, Zoom classes, projects, Google Meets, crusades. remote learning. Okay, those are the answers you have given. And so we move on. Thank you for your answers. They are many and they are varied. Okay, because of in the midst of COVID-19, we can embrace alternative modes of curriculum delivery. And these are alternative ways to ensure instructions are delivered to support and enable learning processes. That is in the classrooms, and also to access the learners who are in different places. We may have learners who are in areas where there is no internet. We may have learners who are in the classroom, but they cannot, the learning and teaching is not effective. So we can actually use other modes of curriculum delivery in order to ensure that learning and the learning process has gone on the right way. And teachers can explore various alternative methods of curriculum delivery for the following purposes. And as I have said, it is to facilitate continuous learning during school recess, or where we have adjusted school programs like what we had, and also to provide support for learners and maximize learning experiences while in school. You are in class, but you can use different methods of teaching and learning. Ensure continuous learning for vulnerable groups, or learners and teachers who are not able to attend school. And some of the alternative modes of curriculum delivery, we can classify them into about 4, where we have blended learning, we have hybrid or flexible learning, we have use of mobile caravans, and also use of online or remote learning. When it comes to the use of blended learning will take place in the school or in the classroom, face-to-face, where the teacher is there and the learners are there. But they are going to incorporate electronic and online media, where you may find a teacher with a phone, or a teacher using PowerPoint slides, whereby the class is hands-on learning, but sometimes the learners can be told to, or can be engaged to study or to have online learning, to study online. We have hybrid or flexible learning. This is where most of the students will do their learning online, but will only come to the institution when they have an experiment in the laboratory, or when they have a project when they are needed in the school. This kind of learning is flexible because the learners will learn when they want to learn, where they can learn from anywhere, and they can also learn what they want to learn. If a person or if a learner want to learn geography, one can learn it at when he wants to learn it. And we also have use of mobile caravan, and these are mobile motorcades which are fitted with devices, power and Wi-Fi, and are used to reach different institutions to provide unlimited quality learning experiences, including where there is no internet connectivity. And this reminds us of many years back where we had the cinemas brought in our villages using motorcades. And these motorcades used to be fitted with the devices and also with the power, with the Wi-Fi. That time there was no Wi-Fi. But we actually came to interact with the world as we watched the cinemas, where most of the areas in our country did not have electricity. So that is use of, it can also happen today, because today we have areas which do not have Wi-Fi, which do not have electricity. The other one which is now common, and actually the one we are using even now, is online or remote learning. And this is where the learner and the teacher or the information source are not physically present in traditional classroom environment. And the learning takes place through technology or over the internet. What there is that people buy bundles, and it can take place in real time or through self-paced learning activities, whereby people can even have discussion forums, they can do assignments, among others. And here we find that there are very many different forms of online or remote learning. And one of them is computer managed instruction, CMI. Computer managed instruction, we have video conferencing. This is where you have the voice, the audio, and also the voice. You're able to see and you're able to hear. We also have audio conferencing. Like what we are using, we are able to see each other if you and also hear from each other. And sometimes you can be muted, whereby you can only hear the presenter's voice, but not see. We also have the use of USB or flash disks. They are not new, whereby you can transmit information or you can record and transmit that information, use of short message, that is SMS. And also in this one, which is a remote learning or online learning, we have talked of computer managed instruction, CMI, and we find that this is a web-based learning, CMI, whereby we have the learning modules which are put on the web for the learners to access. And a link is provided for access by learners. And the learners, the computer management instruction is going to allow the learners to work through the training modules. They are able to look at the modules, they are able to learn, whereby they can move forward and backward, meaning that if they know, it enables them to go forward or to move forward and also go backward. If they are not able to get information, they can move backward to nowhere or to catch where they did not get it right. And we find that the web-based training, those modules, they are also linked to software, and these are called learning management system, whereby they can even record their work. The administrator or the person who is training can trace and see how far they have gone, whether they have cleared with the modules. You can get the record of what they have done. That is computer management instruction. We have video conferencing, and this is a telecommunication media which allows the transmission of digital voice and video through internet. Is like what we are using. And we see that it allows the teacher to be in the one location and others to be scattered in several locations in their homes. We are right now at one point, but our listeners are in their homes. Participants are networked to central location and usually ask questions via the telephone or by web chat feature. The same thing which is happening. Lectures and demonstrations can be effective using this method. And we have example of Zoom. We are using Zoom now, but we can also choose to use Microsoft Teams. We can also choose to use Google Meet. We also have audio conferencing, which is actually another example of remote learning. And it is just similar to video conferencing, but it involves audio only. And the same thing we've done, the participants log in at the scheduled meeting time. They hear the speakers present their learning, and the questions and answers are frequently held at the end of sessions in which participants can either call or talk to the presenter or email questions. Then we have the use of USB flash disk, whereby you can record ourselves and give what we have recorded to the learners using the flash disk. And the learners can use it or can use it at home. They can share it in their homes. And we say that this is a data storage. It is a data storage and which has a flash memory with integrated USB interface. The flash, they are very common, or they are very common kind of devices. We have the use of email, and the email is this is a method of exchanging messages. The email, of course, we all use email in day-to-day activities. For example, many of you had to provide your email in order to log in this meeting. And it requires both the learner and the teacher to own active email in order to send or receive messages. And the teachers can use email in distance learning, and they use to communicate information to learners and conduct evaluations through email forms. So, and also among the remote or online learning, we have the use of WhatsApp, which is both video and messages application that involve use of chat groups. Teachers can use it to create and share appropriate education content with learners. And it can be used in both hybrid and remote online learning. We saw the hybrid learning and also remote online learning. They can also send announcements, notices, and information from specific teacher or class to the group. And we find that institutional administrators, academics, supervisors, head of departments, head of subject should take control of communications related to learners, because we find that it is not everyone who is a person of goodwill, but we may have people who may post the wrong information to the learners. They may post the use of the wrong information to the learners. So we have the use of YouTube, whereby we say that YouTube is an online video sharing platform, and it allows users to upload, view, rate, report, comment, and subscribe to other users. And YouTube can be accessed by anyone who has a smartphone can get access to or can access YouTube. And we find that this type of kind of technology is very popular with students of all ages, and teachers can locate appropriate YouTube videos for use. So normally YouTube is used as teaching aid, or you get teaching aids most from YouTube, and also get an opportunity to take learners around the world on various topics. When you want to show them something which happened in history or in geography, you can use the YouTube. And teachers or facilitators can use and create YouTube channels, and they can do it, or they can upload lessons for learners to access. They can share videos, and showcase their learners' work to the world to motivate them. And there are learners who have become, or whose work has been known in the world through YouTube, whereby a teacher uploads a learner's work in a YouTube, and the whole world come to learn about it. And actually, it motivates the learner, knowing that the work or her work or his work has been shared to the whole world. Learners can also create their own YouTube channels and upload videos, that is to share knowledge, their skills, and their talents. And also, they can also learn from learners from other parts of the world. They can learn from others from other parts of the world. So we find that what you said the alternative modes or alternative ways of curriculum delivery, they are various, they are many, and teachers, we can think of more, we are innovative, meaning that when the school is releases or when you're not able to communicate to your learners or to go to class because of your age or because you've fallen sick, learning has to continue because you can use whatever we have discussed. You can use the flash, you can record yourself and you have back to the learners in a flash disk. And if you have bundles, because there are schools which can, or if there are schools which can afford that, a teacher can learn even from his house, can teach even from his house. Learners can learn from their homes. Those ones who have issues which enable them to, or which do not enable them to go to school in a classroom setup. And it is important for us teachers to embrace technology. And when we embrace technology, it is going to make our work easy, very easy. And we should stop referring to technology, use of technology as that thing. Many teachers will say, okay, this thing will even make me retire. But when you listen, it is actually about technology, nothing else. They don't want to use the technology. And since we are moving on to, we are actually in computer generation age, we should move on with technology. And by 2030, I believe all of us will be there. So if you're able to use your smartphone, and I believe most of us will only know how to use their smartphone, 30%. If you're able to send an SMS, if you're able to send an email, if you're able to log in for this meeting, know that you are on the way, you are almost there. If you're able to take a photo and post, know that you are moving with the technology. And along journey, we always start with one step. So you are almost there. You continue interacting with your gadgets, and soon you'll find yourself being digital. There's the digital literacy. You find yourself being digital. So otherwise, thank you for listening, and you're going to interact more. Back to you, Salome.
Thank you, Madam Joyce, for that interactive session. And I've seen the participants also interacting through the chat box. I want to ask the participants, let's continue to put our inquiries and questions in the chat box. We will reply to them after the next session. So the next session is on life skills, and the facilitator to take us through is Salome Gashina from the Ministry of Education. Welcome, Salome, for this session.
So good afternoon, everyone. So like you've been told, my name is Salome. I'm going to take you through life skills this afternoon. So we shall look at life skills education, COVID-19. Today we've been able to look at some of the challenges learners experience, and therefore life skill education is very, very important to help them cope with these challenges of every day. And it is my hope as teachers, we still teach the life skills. KICD developed a very good curriculum, and it's important that where we have not been teaching, it's a time now that we need to really impact the knowledge on life skills to our learners so that they're able to overcome the challenges. So what are life skills? So we are saying that life skills are psychosocial competencies which enable an individual to develop adaptive and positive behavior, so that they are able to deal effectively with challenges and demands of every day. So psychosocial competence, the ability to develop adaptive and positive behavior to deal effectively with the challenges and demands of every day. That boy who will go and take drugs because of stress, when they have the life skills, it will help them develop adaptive behavior, and they'll be able to cope with the challenges other than getting into the maladaptive behavior. So development of life skills is a lifelong process that starts in early childhood and continues throughout one's life. Not only for learners, even us, we need these life skills, and it's a lifelong process. We keep learning. So the lives of many adolescents and young people, as we are aware, have been interrupted by the prolonged school closures due to COVID-19. And therefore, this has created a lot of feelings of sadness. There's feelings of worry. There's also confusion, sometimes anger, fear. There's also anxiety. And these feelings are out there. So the closure of schools and also the fact that we have COVID-19 now, it has really impacted on feelings. Therefore, children should be able to talk to someone, therefore, whom they trust, a parent, a caregiver, a sibling, or an adult like the teacher, because they are going through so much. Some of them may not even explain what is happening, but when they have someone to share with or to talk with, then they can be able to be assisted to cope with the challenge. So I would want us now to also share on our chat, type on our chat boxes, what are some of the challenges that learners face? What are some of the challenges that the learners face? I'll give you a minute to have them on the chat. Finances, we have illnesses, parental neglect, yes, abusive parents, conflicts, hunger, family conflicts, we have poverty, lack of basic needs, high academic expectations, we have diseases, shyness, illnesses, self-awareness, domestic violence, neglect by parents, emotional challenge, lack of role models, divorce, abusive guardians, conflicts, lack of support, child-headed families, violence, we have sexual harassment, child labor, poverty, negative peer pressure, violence, disabilities, lack of resources, learning difficulties, bullying, death of parents. Thank you very much. Keep them coming. We have family conflicts. So from that, we are seeing that learners they face a lot of challenges. So plus what we have put in the chat, we are also saying that learners, some of the challenges the adolescents and the young people go through, plus what we are putting in the chat or we've put in the chat, is that they have psychological challenges. For example, when they're preparing for the exams, there's also negative peer pressure. You know, when there's divorce or family conflict, psychologically they get quite disturbed. We also have social challenges, like when there's peer pressure, there are poor interpersonal relationships, sometimes even poor intrapersonal relationships, that is a relationship with self, where there are family conflicts also, it also brings a social challenge. Then we also have the economic challenge. A lot of us have been able to put on the chart where learners don't have enough resources, there is not enough money, they don't have basic necessity, sometimes even poverty, and also when the resources are also excessive, that's also another challenge. Learners also go through emotional challenges. For example, the issue of anger management, hormonal influences, issues of self-esteem. We put a lot on the chart. There was also anger, rejection, grief. All those are emotional challenges. And learners also go through spiritual challenges. You know, for example, exposure to conflicting religious beliefs. So you find that sometimes learners also have those challenges when they're exposed to conflicting religious beliefs. This could be at school or also sometimes at home. And this is plus the other challenges that we have put in the chat. So when learners go through these challenges, I would also want us to take just a minute on the chat and just type some of the life skills that the learners would require for them to be able to overcome these challenges. Just type it in the chat. Life skills that learners would require for them to be able to overcome these challenges. I'll give you a minute. Problem solving, conflict management, thank you, assertiveness, guidance and counseling, self-esteem, self-control, decision making, self-esteem again, G&C, critical thinking, self-control, creative thinking, sexual education, G&C, emotional stability, self-control again, thank you very much, skills in Zoom meetings, empathy, assertiveness, role modeling, communication, spiritual guidance, assertiveness again, positivity. Thank you so much. Let's continue. Let them continue coming. So with all that, when it comes to life skills are categorized into three. All what you have put is categorized into three generally. And in category one, we have the skills of knowing and living with oneself. These are the intrapersonal skills, or the skills of knowing and living with oneself. It's about the self. And in this category, we have self-awareness. Some of us have talked about the self-awareness skills. Sometimes learners, as they're growing up, they go through challenges, or even that self-understanding, what is happening to me physically, emotionally. So that awareness, self-awareness skills are in this category. We also have the self-esteem, both positive and negative self-esteem, and self-esteem really affects learners. We also have coping with emotions and also coping with stress. So they need these skills, or these skills are in this category to help them know and live with themselves. So the second category are skills of knowing and living with others. So the interpersonal. So we have the skills of empathy. It was there on the chart. Effective communication is also there in the chart. Conflict resolution and negotiation skills. Friendship formation and maintenance, assertiveness, and peer pressure resistance. So these are skills in the category number 2. Then in the third category, we have the skills of effective decision making, and all this was in the chart. In this category, we have critical thinking, we have creative thinking, problem solving, and also decision making. So these are the three categories of life skills, and our learners require these skills for them to be able to overcome the challenges and also enhance their psychosocial competencies to deal with the challenges of every day. So we are encouraging that learners need these skills in our schools. So again, we are asking, in another 1 minute, I'll ask you to chat, put it in the chat box. Why do you think life skills are important? What is the value of life skills, or why are they important? You can have it in the chat. I'll give you about a few seconds. I mean, just 1 minute. Yeah, the answers are coming for innovativeness, ability to cope with stress, to be able to coexist, for academic excellence, enable learners to have confidence, cope with challenges, build one virtues, add morals, build their self-esteem, enhance coexistence, being able to develop negotiation and communication skills, helping deal with the situation, to coexist, problem solving, holistic development, give them psychosocial competencies, build their self-esteem to be able to accept others, career building, thank you very much. Keep typing to improve relationships and to give the learners confidence. Keep typing them, and plus what you have put, we can add what I have here. is that one of the value of a life skill is to help them cope with emotions. Yeah, to help them cope with emotions. The other value is to help them develop a self-esteem. The other value is to also help them develop assertiveness. Are they able to say no and mean it, even when they are threatened with issues of SGBV? Creating awareness so that they're able to understand their strengths, their weaknesses, their opportunity and threats, and also understand their self-concept. What do they want for themselves? Also, the other value is to help them to give them the ability to cope with stress by giving them stress management skills, develop and model good social mannerisms. Somebody talked about developing good virtues, help them in decision making. The other value is to help them to be able to form relationships or friendships and maintain those friendships. Problem solving, they'll be able to solve their problems more in an adaptive way. They develop effective communication skills. They'll be able to communicate even when they have gone through challenges. They'll be able to say, this is what happened to me. The other one is to develop negotiation skills. They can be able to negotiate their way out, even in times of challenges. Cultivate and nurture critical thinking. Promote creative thinking, and also develop and nurture peer resistance skills, especially when there's negative peer pressure. So in all this, we are saying should not be left to just the guidance and counseling teacher. All the teachers, we have a responsibility, and these are things that we can even integrate in our lessons as we teach. So those are some of the values plus what you have put in the chat. So COVID-19 and life skill education, we are asking how can learners apply life skills during this COVID-19 pandemic and beyond? So how can we help them apply when we have taught them how do they apply the skills? And they can apply these skills through the following. The first one is to engage them in life skills activity that promote self-control, especially, for example, ability to manage anger or aggressive behavior. Also engage them in positive thinking and give them a case study and they analyze it, see how well they can be able to think positively, or empower them with positive thinking, positive self-talk skills, and also organizational habits among children and the young people, giving them responsibility and see how well they can even be able to organize themselves, also how well, for example, they can do the peer teaching. Number 2 is by engaging them in basic life skills. For example, folding clothes, tying their shoelaces, or buttoning, zipping up, self-care skills, making their bed, cleaning their rooms. All these skills, the basic life skills, are they able to take care of themselves? And this also will also promote a responsibility in them. The other way is through socialization. You can watch them as they play and engage them in activity like sporting and games, having activities with their sibling and their significant other, and you can observe how well they're able to interact with each other. And also in social communication, how well do they communicate in a social setting, giving them responsibility to lead in some activities and also in greetings, among others. So then also, how else we continue? We could also engage them with the life skills through self-determination. For example, refusing to do something inappropriate, being able to say no and mean it, requesting and offering to help attempt new tasks where you engage them in activities that they can be creative or they can be innovative, that creative thinking, giving them a problem to see how well they can be able to solve, and also encouraging them to volunteer to help. So this would be another way of applying the life skills. The other way would be in health and safety measures. Already we've been talking about, and we are in the era of COVID-19, aspects of health and safety are very, very key. So they can be engaged in tasks like protection against illnesses, like already the practices for the health protocol on COVID-19 is one of it. Nutrition, Mike Beatrice talked about nutrition, sleeping, being able to adequate sleep, following the signs on the road, and also we said IEC material, are they able to follow those? Are they able to see and also do what they're supposed to do? How to ask for direction from the right people, the pedestrian safety, and also safety in the farm. So we can engage them in these activities that can help them apply the life skills that we have taught them. And just to emphasize again, like Joyce said, on online safety, it's also very, very important that we also engage them in that by giving them information on their own on online safety. The other way is the home living, for example, engaging them in laundry activity, washing the dishes, cleaning, cooking, farming, taking care of the pets, herding, as those home living skills need to be, when we give them life skills and they can apply in the home living. And finally, in their career path skills. The CBC is very good in this, where learners are engaged. They learn by doing. So they're able to use the skills they learn and also their life skills as do, and as they do, they are also really learning. So the career path skills, choice of appropriate subjects, giving them guidance on the appropriate subject, depending on their talents and their abilities. Also imparting on them skills development, the skills of how to study, the skills of how to live with others, and also in terms of their study. So those are some of the areas that we can help the learners apply the life skills. So as I finish, I would say that it is important where we have not been teaching these life skills, we are impressing on the teachers, let's pick it up. Let us not say that it is a subject that is not examinable. It is not examinable, and therefore we don't take a lot of interest in it. Life skills today are very, very important, even during this time and beyond. And as we do that, we wish you well. So that's the end of my presentation. Thank you for listening to me. Back to Salome.
Thank you, Madam Salome, for the good presentation. Let's take the last presentation, then we respond to the questions on the chat. Allow me to invite Madam Joyce Mushori to take us through role of COVID-19 response committees at school level. Madam Joyce, over to you.
So good afternoon, everyone, once again. During my last presentation, we looked at various methods or various ways of curriculum or alternative methods of curriculum delivery. There's a space, or there was an oversight where we did not show, or we did not look at consideration in the use of online platform, considering that we are in an era whereby we have people who can hack the system, where we can get our learners exposed to information that is not vetted. When we are using online platform, what is that we have to consider? What is that we have to online platform. So let us go to our inbox and share. Have something in the inbox. What is that we have to consider when looking at or when using online platform? We go to our inbox and share. The chat box and share. We have to consider, somebody said about finances, age, relevancy, finances. We have to consider age. But apart from that, because they hack the system, this online platform, and expose our learners to information which is not right. We've seen people even posting pornographic literature. It is important that we use the material by KICD. You go to KICD platform, and you are going to find that what they have approved. And when we are giving online lessons, the panelists, or there should be a panel, a subject panel, or whereby the head of department, the head of the subject should be able to vet the information before it is recorded, before it's uploaded and sent to learners. And there should also be structured way of delivering or sharing this content with the learners. And this one is as per what is agreed by the learners, or as agreed by the school, the parents, and this is to prevent the wrong information or undesired sources information going to the learners. And the teachers should only use the online platform that are secure. And anytime you are using your gadgets, ensure that you have a password. You have a password. That is to prevent anyone from posting irrelevancies or things which are irrelevant to your learners. So that takes us to the role of COVID-19 response committee at the school level. So in the morning, I mentioned that it is important for a school or a learning institution to have a COVID-19 response committee. And now, look at your school. Does it have a COVID-19 response committee? And if it does, who are the members of this committee? Kindly have it in the chat box. Does it have a COVID-19 response committee? And who are the members of this particular committee? Or do you have schools which you do not have? Kindly type your answers in the chat box. So they're saying yes. Yes, teachers are members. Is it only teachers who are members? Continue writing. Let them keep on coming. Yes, teachers are members. Who else are members of this committee? The learners, deputy principal, administration, health, parents, teachers, students, and teaching staff. Yes, teachers, pupils, and parents. Keep them coming. So we move on. So we find that every school should have this COVID-19 response committee, as you saw when the first case was realized in our country. our president set up a committee at the national level, and that is where we get most of the information. Even at the school level, we are encouraged to have one, and it is even in the Ministry of Education guidelines. And the members of this committee may include a learner, a representative of the learners, a teacher, a person to represent the teachers, and one teaching staff. We can even have a parent and the parents. And the law of this school COVID-19 response committee is to ensure that all teachers, learners, and parents are aware of the Ministry of Education, Ministry of Health guidelines through protocols. And this, if you go to the Ministry of Education, those guidelines are there. You open the platform of the Ministry of Education, you find those guidelines there. And it is upon this team to understand how to customize and implement those guidelines and protocols in their schools without compromising the safety and the health of the school community, meaning that if they are using sanitizers, they should make sure that they are secure, they are used properly by the learners, that those very small children should not be probably exposed to the sanitizers because they may not use them correctly. And in case of maybe where they have to study outside, they should use tents. Where they are using tents, it is upon the committee to ensure that the health of this community is looked into. For example, where the runners are not exposed to that cold when they are outside. Eliminate new COVID procedures and information learners and parents, whereby they can disseminate them during assemblies, and also use of pamphlets and the flyers. Those ones can be used to disseminate new COVID-19 procedures, meaning that they should be in touch with the COVID-19 committee at the sub-county level, at the county level, and even at the national level. They're also supposed to report COVID-19 cases and close contact to the county, to the sub-county, and also to the COVID-19 coordinator, sub-county COVID-19 coordinators. They should be able to report such cases so that in case a learner gets sick or in the school or within the school compound, they can call an ambulance or they can report it so that the person can be put into isolation or so that the person can be advised. It is upon the committee to oversee administrative policies and also infrastructure. And when it comes to administrative policies, they are supposed to set, they are supposed to set attendance and entry rules. They set attendance and entry rules, whereby they may introduce a register as one is entering the school compound, where one can register himself, have his ID number, the phone number. If it is the student, they should ensure that they know the number of learners who are there, and also check if they have any symptoms of COVID. They should also ensure that the students and the teachers are not close, or they are not in small groups. And if they are in small groups, they are not mixing. They should ensure that there is, as the students start the school, or as they come to school in the morning, they follow the laid-down procedures. For example, where they have to wash their hands at the entrance, or where they have to sanitize at the entrance, and also when they are coming from their buses, and check whether they are supposed to check whether they are close to one another, whether and also that they are not to ensure that they are not congregating or squeezing at one point as they enter the school. Also supposed to ensure that during break are not going for break. They are not going to the bathroom at this time, and they are not also going for meals at the same time. They can do it in shift, whereby one class can go to the bathroom, then another one follows on. So they make that kind of arrangement. And also during ed time, as they go home from school, are they still are they still having their mask on? And how are they going to exit from school? Are they going to be at one place? Or the school can arrange that they go in shift group to leave maybe 10 minutes before the other one. They also supposed to oversee the infrastructure whereby they ensure that there is the organization of physical space of the youth and identify the entry and also the exit. The entry and the exit. Here it means that even if the school does not have a fence, because we have schools which do not have fence, they should mark the entry where all the students an area where all the students will be entering the school and where they will be exiting from school. And also they can also mark direction. You've gone to places whereby you find foot marks marked, showing that they should not keep, or they should be a distance away from each other, or they should keep a distance away from each other in case they are walking. And also they should also ensure that there is hand washing facilities whereby there is water and also soap. And also then the environmental, they are also going to ensure a building environmental design to facilitate appropriate use of space, whereby in case they feel that the classes are crowded, they can have maybe a tent outside. They can organize with the local leaders, because children belong to a society, and in the society we have social amenities. They can organize so that they are given a social hall, so that some people can, or they can keep distance there. We have also churches, and children belong to these churches, and most of the churches have halls. They can use those halls if the classes are not enough. They can talk with the local administrators and ensure that the county office, the Ministry of Education county office, the TSC county office are aware that that arrangement has been made. They also committed to ensuring that the environment is clean, whereby there is maybe fumigation of the building, there is dusting, there is sanitizing the building. The masks are not thrown everywhere, but they are kept in probably a dustbin, which has a lid. They are supposed to maintain clean environment and ensure adequate and appropriate ventilation in the school. They should encourage outdoor activities as appropriate, maybe walking. They can encourage the learners to walk or run around, keeping distance. And also ensure use of appropriate masks all the time. And by appropriate masks, we find that these are masks which are clean and they should be worn well. The masks which have good material and which are worn well and clean. And somebody mentioned that people can use different colors. They can make different colors of masks for their students. In that case, they'll be alternating. If they have one color today, the following day they have a different color, to ensure that a learner comes or report to school with a clean or wearing a clean mask. And they should ensure symptom screening by parents and teachers as they come to school or as they visit the school, and even when they're in the school compound, if one is found to have symptoms of COVID, they should actually be tested and isolated and as per national procedures. Anyone found to have symptoms, if it is a teacher, one can be told to maybe go home, rest until the symptoms have cleared, maybe after those 14 days. And that is what we are saying as per national procedures. And also, they are to ensure that runners, teachers, and also non-teaching staff with respiratory systems have seek medical care and also resume to school after the symptoms have cleared. And also reorganization of school transportation. As they arrive, they are going to see that as the learners arrive in the school compound, do they have the mask? Are they squeezed in the bus? And even when they are going home, are they keeping this social distance in the school? Is the bus sanitized or fumigated? That is their role. And they are also supposed to have clear, accessible sharing of information and feedback mechanism established with parents, learners, and teachers. That is, they are supposed to liaise with the sub-county rapid COVID-19 committee, get clear information about COVID, and they're also so that they can share it with the parents, so that they can share it with the learners and also with the teachers. Let them get clear information and also share the information clearly. And they also supposed to see that there is continuation of essential-based services in the schools. There is guidance and counseling is offered. There is social support. There is feeding, somebody of proper diet. There is nutrition programs. There is immunization and other services. So that is the work of the rapid or of the COVID-19 response committee. And we have key areas of guidelines and protocols. So this was, we can get them from the Ministry of Education, State Department, Early Learning and Basic Education. They have an article, or they have these guidelines where they have talked of health and safety protocols for basic education institution. And in that, we have hygiene and sanitation protocols. We have psychosocial support to learners and staff. We also have non-compliance with the guidelines and specified protocols where they have said that in case the school has not complied, or that school which has not complied to these guidelines, the school should not be allowed to operate. They should not be allowed to provide any service. So you can visit the Ministry of Education platform for those guidelines. Ministry of Education, State Department, that one, and about non-compliance, we'll find all that key areas of guidelines on COVID-19. And to conclude, we can say that today, our priority is to protect people by limiting the spread of COVID-19. You can only protect people by limiting the spread of COVID-19. And that means that we have to protect ourselves and others from the disease or from the pandemic through washing our hands frequently with soap and water or alcohol-based hand rub, which has 60% alcohol. We have to cover coughs and sneezes with a bent elbow. As all the presenters have said, we have to wash our hands after. We have to avoid touching our eyes, our nose, and mouth and also keep 1 meter distance away from others. We can also say that these virus that causes COVID-19, it will infect people of all ages. So it will not only affect the old, but it will affect people of all ages. And evidence today suggests that older people who are over 60 years and those with the underlying medical condition, such as cardiovascular diseases, diabetes, chronic respiratory diseases, and cancer, they are at a very high risk of getting severe COVID-19. Therefore, we all need to work together on how to protect the most vulnerable. And here, the most vulnerable, we have seen this group, that is health workers, who include the doctors, the nurses, who are going to include even the social workers, those over 60 years of age, those with underlying health conditions, for example, heart, lung diseases, diabetes, and those whose immunity is compromised. All those, we need to work together to protect them. And it is important to note that everyone is vulnerable. We will not only talk of those people who have diseases, but everyone today is vulnerable. And this virus does not distinguish the rich or the poor. It does not distinguish the important or the ordinary people, but everyone is at risk of getting COVID. And I'll not say that no one can escape, but you can escape if you take the necessary precautions. And it is important to note that low risk isn't no risk, and that even if you are less than 60 years old and you do not have an underlying health condition, you can still become sick with COVID. So it is upon you to clean your hands often, cough or sneeze in your elbow, avoid touching your eyes, nose, and mouth. It has become a disease. It has become like a song. Limit social gathering and time spent in crowded places. Avoid close contact with someone who is sick. Clean and disinfect frequently. Touch objects and surfaces. Then, as you sit down, as you in a place where you like sitting when you want to engage in serious prayers or in serious engagement, you must reflect on what you must do to prevent yourself and others from contracting COVID-19. Think of the prevention and control measures to be prepared and put in place in your schools. You may be a teacher teaching in lower primary, a teacher teaching in secondary school. You may be a head of department or a head teacher or a principal. Just have some moment and think of the ways of preventing and controlling COVID-19. Because we know that COVID-19 is real, and we must do what we can in order to prevent ourselves and others from acquiring COVID-19. And with that, thank you very much for listening, and may God bless you. Back to you, Salome.
Thank you very much, Madam Joyce, for the very good and comprehensive presentation. At least now schools know what is expected of them, the role of the committees, and how they will be addressing COVID at the school level. Now it is time for plenary session, whereby we are going to respond to the queries raised earlier in the chat. I want all the trainers to look at the chat and identify the questions they are going to respond to. Allow me to start with Mr. Jackson Kihima. Any question that you have identified that you can respond to? This will be followed by Beatrice, then Salome, and Joyce in that order.
Thank you so much, Madam Salome. I will start. As Jackson is still looking through the charts, we had so many questions in the morning, especially on the COVID-19 vaccines, and we tried as much as possible with Dr. Celestine to respond to them, but still some questions are coming, and we still want to say that the vaccine is safe and clinical trials were done, and it's eligible for those who are over 18 years in the country. Somebody asked, they have sinusitis, and they're asking if sinusitis is an NCD. They're saying no, this is an inflammation of the mucous membranes that line the sinuses, and it results in symptoms like having thick nasal mucus, blocked nose. So if you're having that condition, kindly seek medical attention, and it's not an uncommunicable disease. So many questions also coming in. Those with non-communicable diseases, can they be vaccinated? We are saying yes. Even from the previous presentation on uncommunicable diseases, we found out that due to the increased risk of severe COVID-19 disease and even death, vaccination is an added advantage for you, so to enhance your protection against getting infected. Somebody also asked if vaccination for teachers is voluntary or mandatory. I will let Madam Joyce from MOE answer that question. If vaccination for teachers is voluntary or mandatory.
So, as we said, as you said, teachers are frontline workers, so it is important for them to be vaccinated. And you remember some times back, early last month, we saw our CEO being vaccinated. And I believe we should also follow suit. We are not saying that it's mandatory, but since teachers are forefront workers, it is important for them to get vaccinated. That is for their own good and also for the good of the learners.
Thank you so much, Madam Joyce, for letting us know that it is true you have to consent to be vaccinated, but for your own good and the good of the learners, kindly, we encourage those who are within the eligible group to get vaccinated. There's also another question. Most teenage mothers rarely come back to school after giving birth. Others transfer to other schools. So how do you follow up or help them in this situation? Minister of Education will answer that together with this. Sometimes such teenagers fail to rejoin school due to lack of school fees or lack of someone to take care of their babies. Kindly advise. Over to Minister of Education and TSC.
So thank you, Madam. Thank you, Madam Beatrice, for that. On the question where girls get pregnant and they don't come to school, but they may transfer, that would happen sometimes. That may happen sometimes because of the issues of stigma that I had been seen pregnant or my peers know that I'm pregnant. But again, it is important that we work with Ministry of Interior, that is the chiefs and the the deputy commissioners and the assistant county commissioners to help us on this, because they also have a responsibility in that return to school policy, so that they also are able to help us, because the chief will understand where these kids are and they can be able to follow up. There are, however, some who may not be able to come back to school because they have no one to take care of, but it is important that we put effort on ensuring that we work together with the Ministry of Interior so that they help us on this. There are also well-wishers we have seen even in some counties, so it is good to link, and that's why we are saying the linkages, the partnership, the working together is very, very, very important, so that as schools we don't keep quiet to the challenge, yet maybe we took it even to the children's officer at the sub-county level, they would be able to assist us. So that's what I would have to say. I hope I've answered both, Beatrice. Thank you.
Thank you so much, Madam Salome Gashina, for that. We hope it's becoming more and more clearer, and we are getting to understand these issues better and how to manage them in our schools. There's also a related question saying there's a big deal of stigmatization of pregnant teens and also the teen mothers who are still in school. How can the school handle this situation? The pregnant teenagers who are still in a school setting.
Okay.
And I think I said that a learner can go to a school of her own choice. A learner is not forced, it's not supposed to be forced to stay in that school. If the learner is uncomfortable to learn in that school, kindly the teacher, you can lie with the sub-county director, the county director, so that the learner can be transferred to another school to avoid that stigma and the discrimination of our learner.
Then I think I can also add, and just like Jackson had said on that, the psychosocial support is very, very key for even these learners, these learners who are pregnant, because emotionally it's very disturbing. But again, when we give them psychosocial support, the assurance that is there, and also the help or psychoeducate the other learners on the issue of reducing stigma for them, that would also really support them, and they would be able to move on. You can also have a support group depending on how many they are. We saw a school having a support group for them, where they're even assisted to go for the prenatal clinics, and they also are given that psychosocial kind of support, and they're able to adjust, adapt, accept, and integrate in the learning institution. Thank you.
Thank you so much, Madam Salome. I think the last one here is to TSC, and they're asking, the training is very useful. How we wish we could integrate such programs that you talked about in our regular curriculum under education in emergencies, since such natural and artificial disruptions to learning will never cease to occur in our lifetime. Kindly address this.
Okay, thank you, Beatrice. What I'm saying is that this is an emerging issue, an issue which requires time to be deliberated on. So we are going to wait upon our KICD so that they can see whether to include it in the curriculum. So what we are saying is that it is an emerging issue, and it has to be looked at. So we give it time.
Okay, thank you so much, Madam Joyce. Is there anybody who has identified any questions that they may need to react to? Kindly proceed.
Yes, let me just post this question to Daktari. Someone is asking, how long should one take if they have COVID-19 before they get vaccinated? Another one here. Someone is asking that a child was born with HIV and was put on drugs. After sometimes the girl was found negative at the age of 8. So someone is asking to explain. I think the child was born with HIV, then she was put on drugs. Then after 8 years, the child turned negative. So I don't know if that one happened.
If someone gets a job and they get pregnant, you get the COVID-19 vaccine, at some point, how long should you be
So thank you for the questions. I think the first one was about the vaccine. If you had COVID infection, how long do you wait until you get the vaccine? And the last discussions that the ministry had was you stay at least between 8 and 12 weeks. Actually, the longer you stay, the better. So around 12 weeks is the recommendation after a COVID infection. Number two, if you get the COVID vaccine and you get pregnant, what are the effects? We don't know. The vaccine is quite new in the market. Right now, the guidance is that if you're pregnant, if you're breastfeeding, then we hold off on it. So what I would recommend is now a case-by-case approach. Visit your healthcare provider, explain that you have the vaccine for closer monitoring on any effects on the fetus. And then the other one was around a child who was born HIV positive or diagnosed with HIV when young, took ARVs for 8 years, and then became HIV negative. A very difficult question and a very political question, so I'll be very careful how I answer it. There have been very few of these cases, and usually if you look back, it is normally an issue of the diagnosis at the point of birth. So depending on the tests that were carried out, depending on what tests were used, because we normally have an algorithm for testing babies so that you're sure that if you're diagnosing a child with HIV, you're actually testing the baby's blood and not the mother's blood, because the mother's blood crosses across the placenta into the baby. So you may actually have, if you do the normal test, the rapid one you do at the VCT, if you test a baby who's been born of a HIV positive mother within the first 9 months, you probably are going to pick up the antibodies from the mom. It will not mean that the child is negative, is a HIV positive. So usually at times it is what test was used, how the tests were stored, the person who was carrying out the test. But as we speak today, there's no case of anybody being cured of HIV in Kenya. I won't say that categorically. So we should not say that the ARVs cure them of HIV. Usually it's an issue with the testing. And that is why, as a ministry, we have been so particular about putting the algorithm for testing. We just don't base our tests, our diagnosis of being positive on one test. We do a series of tests, even for the adults. We always have to confirm that it's actually a true positive. Yeah.
It's another difficult question. Please confirm women missing periods after vaccination.
I had talked about it earlier, and I said this is the first I'm hearing of it, so I cannot comment. I would not say that it is a side effect of the vaccine, because obviously if a woman misses her period, the first thing we want to rule out is pregnancy. So if that's what I said, if you have taken the vaccine and then you notice signs or symptoms that are not normal, please visit your healthcare provider for a full workup. I think also because of the misinformation out there about the vaccine, everything which is negative is being blamed on this vaccine, and that should not be the case. So what we always say is go to somebody who's experienced, who is qualified to do a thorough assessment and ascertain why then are you missing your periods. And I know from the Ministry of Health perspective, every side effect that's being reported actually is being captured by the Pharmacy and Poisons Board. And there's a team that's actually following up to look at those adverse effects and actually to make a determination on the safety profile even for us here in Kenya. So if anything is untoward or different after the vaccine, go immediately to the healthcare provider for a thorough assessment, a thorough checkup.
So this question is being allowed during PE allowed during this considering games have been suspended. Games have been allowed. So I think here the games are allowed, and PE also PE has been or had been suspended. But I believe that even taking learners outside for a walk is PE is physical education. Even taking learners for a walk without them intermingling, they'll still have performed a physical exercise. So it is not necessary that they go together in the field and hold each other, do the physical exercise. What I can say is that students can go for PE, but the teachers should actually monitor how they are handling themselves, that they should not mix or they should not intermingle, whereby they can take them for a walk, because education is also very important. Also, somebody has talked about inadequate staffing and COVID-19 protocols with inadequate staffing. So there, I think we talked about the use of space, whereby instead of having the runners in the classroom, we can take them outside, maybe under the trees, and if they're not trees, we can liaise with the local administrators where you are given a social hall, so that you can use it. And also we can use other alternative methods of teaching or alternative methods of delivering the curriculum, whereby you can, if there is power, you can use the PowerPoints and the slides, or we use the tents outside. So I don't know whether, and also we had also talked of where people can go to school in shifts, but this one you have to agree with the local directors, the local sub-county the local offices, the TSC at the county, and also the Ministry of Education. Thank you.
Thank you so much, Joyce, for that response, and thank you to Dr. Celestine. And I would echo what Dr. Celestine I have said, that please desist from associating some of these conditions with the vaccines, because we had these conditions even before the COVID-19 vaccine. And in case you're having any after vaccination, please visit your nearest vaccine center and let them take your data and report that effect that you are having, because so many questions are still coming. But we want to say COVID-19 vaccine is not associated with infertility. It is not associated with erectile dysfunction. And we said before that children are currently not being vaccinated. Dr. Celestine, I would want you to quickly maybe talk about association with blood clots, if COVID-19 vaccine can cause blood clots, because so many concerns are coming. And a person has said that they have deep venous thrombosis, DVT. Can they access the vaccine? And also, is it true that people with blood group O or B positive are more vulnerable to COVID-19? We'll have Dr. Celestine talk to us about that.
Okay. This group of teachers reads a lot. Okay. Interesting questions. So about the blood clots, a couple of countries in the West have reported that they had a few patients who had developed blood clots. But on further analysis, it was discovered that they already had predisposing conditions that could have caused that. So it's not necessarily the vaccine that caused the blood clot. However, if you have DVT, which is a clotting disorder, I would recommend that before you go getting the COVID-19 vaccine, you actually consult your healthcare provider. Because like I chatted earlier, getting the vaccine is voluntary. Nobody is being forced. So you have to weigh your risks versus your benefits. It is important that you just don't go into a center and get the vaccine. If you've got any predisposing underlying condition and even just a general concern, visit your practitioner and let them advise you based on your risk profile for getting a COVID, based on whether you've got underlying conditions or not. So just walk into a center and get the vaccine. That is what I would say. Number two, there have been concerns, and I've been seeing on the chart, if I get the first jab and I can't get the second one, then what? The first COVID-19 vaccine gives you at least 50% protection, which is better than zero. So the hope is that we are going to have enough vaccines to be able to give a second one, which is going to increase your protection rate by up to 70, 75, 76% thereabouts. But even if you don't have it, you have got 50%, which is more than you had before you got the vaccine. So you still have got some level of protection. Now, are we going to be required to keep on getting the COVID vaccine each and every single year? Maybe, I don't know. Coronavirus is actually a virus that mutates or changes very, very quickly. It is like the virus that causes influenza. And for those of you who read a lot in the West, that usually during the winter months, they have got epidemics of influenza virus, which kills a lot of their old people. So every single year, they have to keep on giving the vaccine for influenza. So for the COVID-19 virus, we don't know. We are still waiting. Depending on how quickly it mutates, then there might be a need to be giving vaccines every so often. But for right now, this is what we have. Again, like Madam Beatrice has said, please let us cease and desist from a lot of innuendo, a lot of false information. If you need anything, please, there are accredited websites. There's healthcare providers. Go and get the correct information from there. Thank you. I think I've covered everything. Anything I've left out? I think that's it. Okay, thank you.
Thank you, Dr. Celestine. That is well covered, and I know we can comfortably say that COVID-19 vaccine is safe. The last question to the Ministry of Education. Someone says, it is a great challenge to keep the pregnant student in schools, given the health issues that come with pregnancy, nutritional issues. If only female teachers are given maternity leave, it's in order for the students who have delivered to take a break from school, because even the infant has a right to care. Could you comment on that?
So thank you. There's a question on keeping pregnant girls in schools. It's quite a challenge, and the question is saying even when lady teachers are pregnant, they get the leave. So yeah, it is true. It is challenging to keep them into school, but again, there is also a provision that they can be allowed to go to take a break and then come back after giving birth. Yeah, but what we are really emphasizing on is while they're in school, they will be given the psychosocial support, and where possible, even that nutritional care and support is important, just to make them comfortable for that particular time, and then they can be allowed. They go and give birth, then they can come back to school. So it requires a lot of support from the institution. And also, we could also get help from other people who can be able to support the children, the such girls, like I had said. Yeah, the essence here is that they do not lose or stop school because they have given birth or they are pregnant. Thank you. Maybe I could also answer another one I had seen. Beatrice, if it's okay. There was also another question on trainings of the institution COVID-19 response team. And the question was asking whether MOE and MOH can collaborate for the training. This can happen at where the schools are. Like we had mentioned earlier, we have a sub-county COVID-19 response team. So the schools, through the TSC or the education officials of the sub-county, can request for that training. And I'm sure it can be offered in our learning institutions where we are. So those committees, like we had said, it's important to be trained. This can be organized. The individual schools can organize in their sub-counties how this can be done, and especially through the sub-county COVID-19 response teams, because this training and this information is very, very important. Thank you. Back to Beatrice.
We are doing well. If anybody has identified any other burning questions, kindly you're free to respond to it. And there was a question whether if a person has sickle cell disease, they can be vaccinated. Dr. Celestine, do you want to help us on that? But we had said during the presentation on non-communicable disease, the risks of the vaccine, we are saying that the vaccine is safe and anybody with the non-communicable diseases can access the vaccine. But we cannot advise you because we are not seeing you. We do not know how far your condition is. Kindly visit your nearest medical facility, talk to your doctor and let them evaluate you. If it's now back to a personal level, your condition that you are dealing with right now, please seek medical attention before you make some decisions. Don't just take it as a blanket advice. Thank you. MOE. The question whether we need clear masks to schools, maybe for the learners who are deaf. Minister of Education.
As they're answering, there's a question on what is COVID-19 variant. So a variant is just a virus, and like I said, the coronavirus changes or mutates a lot. So depending on the number of times that it's actually changing, then we say those are the different types of variants that we have. So I know right now you're hearing of the Brazil variant, there's the Indian variant, there's the South African variant. So that is what we mean by those variants. So also as a ministry, in track of what variants we have in country. And I'm sure when that data is available, then they shall be able then to let us know. Can the vaccine be given to somebody who's HIV positive? Yes, there's nothing stopping you from getting the vaccine. But like Beatrice has said, please ensure that you go to a healthcare provider and explain this is my situation. They will do a thorough assessment of you at the time of getting the vaccine, and then you can make a determination when you're fully armed with information. Yes. What can somebody do who is and doesn't want to disclose, especially a parent, and you suspect or know from other sources? There is no legal obligation. If I'm HIV positive, I must disclose my status to you. and no arm of the law can force me to do that. However, from a health perspective, we do encourage disclosure to your sexual partners and children who are HIV positive, then telling them that they are HIV positive, age, of course, depending on the level of maturity, so that they can be able to take their medication. But nothing can compel someone to disclose their HIV status. Your health records your health status. Whatever condition you have is your personal business. And even me as a healthcare worker, I cannot disclose your status even to your own spouse. That is not what we do in practice. So what you do is you just keep on encouraging those who are HIV positive. Once they feel comfortable and they're okay, then they disclose. A long time ago, I think we used to say we will not start on treatment until we have a treatment partner, but nowadays, no. For as long as the patient understands their status, can be able to take medication on their own, free to do so.
Thank you so much, Dr. Celestine. That is very, very well put, and we thank you for that. Moving forward, somebody is asking, will the Ministry of Health provide thermoguns, face masks, etc. to our schools? No. Kindly, the school administrators, the guidelines were given from the Ministry of Education. Please find ways of equipping your schools with these needed equipments so that we fight this virus together. Mr. Jackson, there's somebody who is saying on Mr. Jackson's last slide on HIV presentation, there was a point on a child who is HIV positive and cannot transmit it to another. Please give a clarity on that, please.
Thank you. Yeah, what I meant is that a child who is below 2 years is not sexually active, and therefore he cannot transmit the HIV virus to another person. Yeah, unless it's a wound or he has come into contact with a product, a blood product or something. But through sexual intercourse, the transmission, he cannot transmit because he's not sexually active.
Thank you so much. And what is the appropriate age to disclose to a child that he or she is HIV positive? Yes, that's another question. Yeah. Dr. Celestine, could you assist with that?
Okay, so we say disclosure starts depending on the maturity of the child. You may find an 8-year-old child who is very mature, and you get a 15-year-old child who cannot be able to handle that information. So there is no specific part of age. What we encourage parents to do is to work with a healthcare provider from as early as possible with the children to start preparing even how to go and disclose. Because once you disclose status to a child, then a lot of questions are going to come from the child. How did they get it? And you as my parent, how did you get HIV? So it's normally a very uncomfortable situation. But we do have counselors who can actually support the caregivers, the parents on an individual level. So please work with those ones. Don't attempt to go and do it on your own at home. It could actually backfire on you. So go to your healthcare provider, work with them, and then agree to give your child information based on the level of maturity and understanding. However, it is important that at least by the time they're teenagers, they know. We are having a lot of problems with adolescents refusing to take medication, becoming rebellious and defiant simply because nobody told them their status. And they usually know. They're not, kids are very smart. They'll come to the clinic and they shall know that I'm actually taking ARVs. They're even going to Google, learn from their friends. So sometimes when you think we are protecting, we're actually doing more harm than good. So work with the healthcare provider and work on the disclosure. Children have sex at very young ages. Can a HIV positive child infect the other in such a case? Yes, they can. Yes, they can. we are having children as young as 9, 10 being sexually active. So if one of those ones is HIV positive, they're going to infect the other one. And that is why I think what the ministry is talking about, life skills, I think also engaging parents to be able to give information on human sexuality is absolutely, absolutely critical. They're experimenting a lot and they're putting others and themselves at risk. Thank you.
Thank you so much, Dr. Celestine. That is very, very well put and very, very well answered questions. Lastly, somebody is asking if the Ministry of Health is going to vaccinate children before they open school. We are still repeating that currently one must be over 18 years of age to be eligible for the COVID-19 vaccine. Thank you so much for all your questions and being active. We hope that we have given the correct information that you needed. And now I'm taking back the program to Madam Salome Ochola to guide us on the next steps. Thank you so much.
There is a question on private schools. I don't know whether Kihima could respond to it.
Thank you, Salome, for noticing that. Some private schools ignore COVID containment measures while transporting learners in vans to and from schools, and the policemen don't intervene. What's the way forward? Minister of Education.
It is important in such a case that you report the matter to the office of the county director so that the matter can be taken seriously.
Thank you so much, Jackson. Salome, do you have anything to add?
The training materials have been shared on the chat. Schools administrators and teachers, please download your copies from the chats so that you can have the PowerPoints of what has been presented. We are now moving to the closing session of this workshop. And before we start that process, allow me to invite Mr. Elias Chepto to tell us about the refund of data bundles. Elias, over to you.
Good afternoon, team. Well, about your reimbursement of airtime, I wish to report that by close of business tomorrow, we should be in a position to refund back your airtime. Keeping in mind also that let me hope your details are correct, are in order. In case of challenges, we shall get back to you tomorrow. Thank you.
Thank you, Elias.